moderar
this session. My name is, for those of you who don't know me, my name is Lidice Lopez. And so we think that this meeting is truly important. We've been promoting this meeting for a couple of weeks, but it's been designed for a longer period now. As you are aware, as you know, Latin America is receiving less and less funds from the global context, and that situation has been happening from the past 2 years. So for us, this transition process it's a key element, so we can assure those achievements and progress towards the response of the TB, HIV, and malaria. So taking that into consideration and within this framework, we consider that it is important to focus the attention in two main aspects. First, we need to strengthen the national plans, or we need to strengthen the tools that can guide the national responses, and also being able to increase the coverage in this transition on the cooperation resources into national resources. And in between also, we need to design and implement these grants that will be financed by the Global Fund within this transition period in the next 2, 3, or 4 years, according to the country. So we can transition in a more efficient and harmonious way. So in this webinar, we will focus in this last aspect in the transition proposed by the Global Fund against HIV/AIDS and malaria for this eighth grant cycle. So we will get to know, and we will analyze those guidelines proposed by the Global Fund for this cycle. We will also discuss where is it that the civil society organization as well as the communities can be included and can participate within this new grant cycle. So let's find out what's going on and what's putting into practice in Guatemala and Paraguay. These are the two examples that we have to share for today. So without further notice, I would like to give the floor to Julia Perrone. She is responsible for the area of Latin America within the Global Fund. And we're so happy to have you back here with us, Julia. The floor is yours. Thank you so much, Lidice. Thank you, everyone and everybody. Thank you for being here today. And also thank you to the LAC platform for organizing this webinar. I would try to be brief, and I will try to be clear on where are we and why this discussion is important as of this moment. So as Lidice has mentioned, we're just entering the eighth cycle for the Global Fund in a very different situation that we have lived as of now in Latin America and the Caribbean. So the context is completely different at a global level in the sense of the reduction of the grants. There's a lot of uncertainty with regards on this geopolitical context, and also there is an emphasis on the discussion not only from the donors but also for the countries, especially in Africa, on the local needs on the countries that they should be self-sufficient as for the health responses. So that for the Global Fund is being translated into the most important changes on the fact that for the eighth cycle grant, those countries have specific transition terms. They are very clear now. So this is the first time that we have a well-structured and we have a clear date for each one of the transition countries on the financing from the Global Fund through the national allocations. And that changes a lot the discussion that we have in the region. We are not designing anymore those programs as if they should continue indefinitely, but we are just designing now programs asking us this clear question: what will happen when this last grant is finished. And in this sense, the communities are truly important to be considered. So, to be honest, we know that the control of the epidemic and the transitions are completely different things. We know that most of the countries will remain with these gaps once the global fund is over. So the question, it is not how to be sure that we can solve all the problems in the last grant or in the last grants, but the question is, and specifically from the community perspective, what are the services and what are the spaces as well as the participation mechanisms that we would like to be sure to keep and to maintain within the national system without the funds from the global fund. And obviously, the risk is very clear, especially when we speak about the services for the key populations and most vulnerable populations, that those services can stand the transition and that those services are the ones that will end servicing, giving the services from the grant that they depend on. So if I need to summarize the key message for this is that the transition doesn't start when we finish the project. The transition starts now when we design these grants for this 8th cycle. And each decision that we made in the designing and in the planning has to consider this transition perspective. And that doesn't mean, that means that we will have some uncomfortable discussions, but that are needed. We need to define what is it that we are going to set aside, what is it that we are going to prioritize at any cost, and what are the things that we should do in a different way. So I think that in that sense, in order to make things different, we can see also opportunities. We have the opportunity then to think on what are the services and what are the services that we can offer and what are the most effective and what are the ones that we would like to prioritize. We also have the opportunity to integrate the civil society organizations within the national systems and also to open new alliances with those actors that we haven't worked that much as of now. So the role of civil society is important not only on the design but also in all the advocacy and incidents that we'll have, because it is clear that the success that we will have in this transition process, it's outside in the role of each one of us. But what really remain in the countries will be those services that can be defendable, that are legal, and that have this social pressure to be kept. So as you know, as you see, I don't have any prescription or any answer, but I'm interested in opening this discussion, to have this open discussion with these topics. Even though the context, as I said, is less than ideal, the global fund still is one of the main actors as for the TB, HIV, and malaria in the region. We have the ambition to keep on supporting within this process up to 2030, and also to be to thinking on how, what the role that we can have after this transition process. There won't be any country by country allocations, but we can start on thinking what are the other types of support that we can provide in a more regional way. So, and the topic also is that every time the value that we'll have will be less, but the money that we will give, and the idea is how is it that we're going to use that money for the coming years, and so we can strengthen the civil society for what will come next. So hopefully we can do this exercise together the best as possible. So then it is not moving backwards, and that will depend on the decisions that we made as of now together. So happy to start this discussion today with you, and I'm grateful, and I give now the floor to the rest of the speakers. Thank you so much. Thank you so much, Julia, for opening this webinar, stating the challenges and, as well as the questions that from each of our countries, and within this process that we will start with this eighth cycle, we will need to answer, and we will also need to design in the following months. So now, so we can start this discussion, and so we can start knowing about the guidelines and the updates as for the policies from the Global Fund and what are the expectations set for the countries. I will give the floor to Maria Petro. She's part of the Global Fund team. Can you share? The floor is yours. Thank you so much, Ladies. Can you see my screen? Yes, we can see it. Thank you. Thank you so much, everyone. Thank you to the LAC platform for this invitation. And so creating based on what Ladies mentioned, as well as on what Julia said, we just wanted to share today with you some of the novelties, or the novelty, it's only one. And so we would like to focus on that, as our the audience is also focused on the communities. We will give that approach. So today, let's speak a little bit of what is the new, what are the implications from lack, and what are the things that we have learned, and what is the fight that we're facing. So what is the new? Basically, as Julia mentioned, we have these defined transitions and there's more flexibility. One great evolution going forward is when we were just designing this presentation, we were just looking the one for 2023. We also did it with the LAC platform in a participation just like this one. And we were just saying, we were just looking to what were the changes that we have had. And the Global Fund right now is introducing these strategic changes for this eighth cycle. But basically they are designing these sustainable programs and efficacy transitions. So the main change, as we can say, is that we have these terms that are already defined. There's some transitions that are specific, but we can say that from the rest, and also being simple for the Latin American case, and due to the fact that in a certain way we've been preparing for the sustainability on this transition, and even though it won't be enough, we still continue with these definitions. We need to keep on planning. We need to do this correspondence with the co-financing requirements. And in this case, we will have some certain flexibility, but we are still on that process. The thing is that now there is this urgency. It has to be accelerated. And as Julia said, the transition doesn't start when we finish, but it starts now. And that's why here I just need to clarify that when we speak about a transition, and this is key, mainly because right now we're starting cycle 8, and we started all those processes that we are running in Guatemala and Paraguay. So we need to think on the transition as the process. Transition is to plan. So let's use all the tools, all the plans for that, so we can reach in a very successful way. And then once the Global Fund leaves, so we won't be perfect, we won't reach all the goals, but let's trust that we have a process and that there's a planning. But then how is that, how do we see at these terms? So this is what we have understood. We have these final allocations that goes for the eighth cycle. That's the one that we have already started within these dialogues. And also we start the implementations for the next year for some countries, and then the rest. So we also have some allocations for the next cycle, for cycle 9. In total, we have 63 components and 35 countries and 3 multi-countries for all the Global Fund. And as for the cycle 9, 21 components and 12 countries. What does that mean for LAC? That means that we have 12 under transition, and the others that are ended in cycle 8. And we have 2 countries and 4 components that will end in the cycle 9. So why this is useful? Well, this is something urgent, but also what we're looking with that is to prevent and to have also this transparency, and all the things that we have done even before has to be done stage by stage, and in that sense we can avoid some abrupt transitions or some that might interrupt the services. So how does this is being translated for the Latin American and the Caribbean? Well, broadly, we can say that we have a budget reduction, we have a higher differentiation, we have an accelerated transition, as we have already mentioned, and there are some other risks, and that's the main focus on this presentation. We want to see how we are facing those, and hopefully we can hear from you. And also the idea is to share what we have learned. So it is clear then that we have a budget impact. The allocation for all the Latin American region for the cycle 8 was reduced around a 29% compared to cycle 7. So it is important to highlight here that by mid of cycle 7, previous cycle, there was also a revision process due to all the things that Lidise and Julia mentioned as for the geopolitical and global context. So starting with this point, there's an important reduction in terms of the budget. But then why is it that we have this? Well, there is a differentiation here, and the Latin American and the Caribbean region, it's also in several maturity levels, and that makes us, as a secretariat, to continue focusing as compared with other countries. What does this mean? Well, this graphic tries to show how the formula and the allocation is being used. Basically, it has two variables. On one hand, the per capita income, national income, and then the load of the disease. So most of the countries from Latin America are found in this area, in this purple area. These represent less than the 5% of the load for diseases among all the countries that the Global Fund is supporting. So these are all the countries in this area, including Latin America and other regions. So what this picture is showing us is that those portfolios are completely different. You can see that the scales that we have through all the different portfolios and countries that the Global Fund supports. So the reflection here is how can we struggle again because we're being differentiated in that sense. So at the end, this is being translated. We have a defined translation. These are the countries. I won't mention one by one, but basically these are the countries that we have for this accelerated transition for cycle 8, the ones for cycle 9, and also those countries who do not have any defined transition, that basically are three: Venezuela, Haiti, and Nicaragua. The rest of the countries in Latin America, they have a defined transition. So between all these, we will also need to plan, we need to estimate, we need to define the estimators, but the risk is still potential, because even though we are being differentiated, and let's say that the countries, LAC countries, are of a high income, and we also have between all different studies, most of the investments are in the countries of Latin America, had been supported by the Global Fund. They had also been assumed, but there's also a certain dependency, and that dependency is mainly on the prevention services, mainly for the key population and vulnerable populations. So in this case, we need to keep also our approach, our focus, and then we need to continue prioritizing and making that differentiation. And this approach says that this is a very palpable risk. Why? Well, because there might be some strong barriers to have access for these community services for key and vulnerable populations. Why? Well, By looking at this analysis on what is it that a global fund supports in the countries, we have that one-third of the populations in lack receive the services critical for the prevention through the civil society organizations that are financed by the global fund. But why is it that we have this model? We don't need to discuss that, but it has been truly clear based on the evidence because of these lower barriers that we have. The civil society organizations and community-based organizations are the main entry point to these populations. However, this is a model that still is fragile in the sense that it is not completely integrated, and this is one of the great tasks that we need to do, and that it also depends from this financing. So in this case, the big question is what will happen when this global fund financing ends. And in that sense, here we need to focus on that, because usually for those who are backwards are less protected within this transition, and this is something that we have seen in some other experiences. So the big question then will be, how do we protect those community services? How do we do this mitigation? And this is what we would like to discuss, and that's why we would like to listen to our countries from the countries. How is it that we are going to protect this? And also, this is what it has been. Reach with the global fund, but also thanks to all the efforts from the organizations and the communities. So the big risk is there that the services are exposed to interruptions, and there's then this big task on how to integrate this community arm within the national systems. There's a potential mean. We will see how much have we achieved, but when we consolidate these agreements, formal agreements between the government and the organizations, this could be one mean, right? And also, these means are shown in different alternatives. How the governments work together with the civil society organizations, we can have several aspects and in different ways. Here we just join as a high and limited formalization. We don't say that one is better than the other, but we're just showing here how much or what will be the progress that we can achieve within this formalization according to the organizations and the government. So here we can see that from a limited one, there's an agreement. There's a no monetary agreement, or there's an indirect agreement, and there are other that will be hybrid, or there's another one that could be a social contracting. So what most of you know, this social contracting, we can say that this is like the standard. This is the direct contracting of the organization. However, each country has its own context. So, being honest, and here we also need to be as realistic as possible. What is it that we have achieved? Have we have some progress? Yes. Is it measurable? Yes. But it has been it has not been equal. Some of them have been completed. Yes, we have this legal viability, we have pilot programs, and we have these early institutionalizations, and we have several steps that can be rescued. Some others had been partially reached, and we have several adaptation on acquisitions, and there's been a budget adaptation. But there are some others that had been blocked or had been delayed. So of course there's some progress, but also we have some limitations. So do we need to recover that progress? Yes, it is key that in Latin America and the Caribbean at a global level, we have very clear examples and specific ones where we can learn from. And in this case, we have great progress with this formal means of public financing in Dominican Republic. We have a great advance in that sense. And then those who are running, we have several political commitments with different agreements and resolutions, as well as some pilot programs, and also not at a great scale in this feasibility, but yet we don't have these legal aspects, and we have some bottlenecks according to the political and geopolitical aspects, and some others that have been explored, and some others that it is not possible. So we can say that we have a great variety on the learnings, and even though the transition in lag has not started yet, those are topics that we have discussed before, and we can say now that it could be working, what can be working and what could not. So what have we learned? And here we want to mention some key learnings, because we know that social contracting is real, but it is not equal, in the sense that not in everyone can be applied equally. So therefore, at least from all the last cycles, what can we bring here? Well, we can say that for the reduction of these risks, or for the, or as for the lack of acceptance or implementation of this social contracting, or the formalization of the organizations and the governments, something that has helped us a lot are the pilot programs. Something else that has worked us, so those approaches based on results, and that's why in some countries from Latin America, we have the mechanisms of what we call this contracting based on results, or the payment based on the results, in more than 10 countries in Latin America. Therefore, we can say that these are steps that little by little they are giving us some ideas on where is it that we can go and move forward. What is clear, the commitment, and these are decisive aspects. And in this sense, we can also need to call the community not to stop, because I know that it takes time. It takes times to do this advocacy, but we've been able to achieve it. And also within this fight, we can continue, and the idea is to keep on doing that. We also should choose the financing and the institutional mean, because some of the backwards steps that we have had on the formalization of the organizations and the government is because we don't know all the possible aspects that where they can be financed. So something that we have learned here is that we need to explore as much as possible, as from the micro to the subnational and national levels, because we have seen that there could be a great umbrella of different alternatives. It is not always needed to do it on the central point downwards, but there could be some other means, and not all of them should be through the health ministry. There could be some other means through other ministers or through other type of institutions. Something also that has been a linking restriction is the regulations of the contracting. We are contracting services. This is not the same to have a purchase of several services, such as maintenance. In this case, we're speaking about more complex services, but that doesn't mean that it's an obstacle. That only means that we should prepare ourselves in a more organized manner to see what are the services packages and how much do they cost, and so on. Something else that we have learned, and that within this discussion we want to give an emphasis and to give a wide perspective, is as for the strengthening of the civil society organization that will accelerate the scale and the sustainability of the services. So something that we have learned is when we have this social contracting, and when it is not possible or when it is difficult, we need to keep on protecting this continuity. But how we will do that? Well, a key point here, and something that the Global Fund is that the LAC team has started in different countries, is to keep on strengthening the skills of the civil society organizations. So, but with a more broad perspective, with all these potentialities or possibilities that could be there. In what sense? Well, it is key that for the transition, the organization should have a internal strengthening that has to be truly strong. And for that, you also need to have within all those country dialogues to make a negotiation, let's say a constructive one, to see how is it that you are from the inside, and let's say what happens if the global fund makes those transition, and if we can continue alone or not, what can we do, what can we not. So let's be honest, and let's analyze what can we help each other. And this, the portfolio diversification is key. This is something that we have learned, so that's why we want to continue supporting those organizations on the revision and the proposal of these portfolios, more beyond those services that are being supported by the global fund. We have seen that these platforms from different types of services had worked a lot in some business models. So all these ideas of social businesses. And the third one is that the creation of opportunities and market mobilization, fundraising, networking, collaboration, synergies, and all the public and private sector, as well as the social sector. So let's take into consideration and be open to this negotiation, and let's see how is that this cycle 8 can be worthy, so you're out strengthened. That doesn't mean that we won't continue working with the authorities. No, we will continue that, also trying to finding those synergies, mostly with the communities. In what sense? Well, we see that on the decision making process based on evidence, in all the diversification on the different modes of contracting. It is not only from the central and downwards. There are several ways on contracting, and also we are still creating the momentum. So what do we mean by that? That we are creating spaces as a supranational and supranational levels, and that's the task also of, as a global fund, to keep on opening these spaces. We not only with the health ministry, but also with the finance ministry, as well as education or the embassies, for example, so we can keep on spreading as much as possible, and also being able to help to create and develop these synergies with all the actors involved. So it is clear that there's no only one formula, but at least we have learned a lot, mainly. And in this discussion, it is key, how is it that we considered this communitary and transition sustainability. Some of the pillars that we have is the integration in the national response. So we need to work as much as possible with the national authorities. We need to be very creative, but we need to keep on working with them. We also need to have this value proposal. As social society, we need to keep on demonstrating that we provide an added value to this, that we have the evidence that with our participation is there, and that we need to keep on doing that. We have also found that the clarity on all the proposals is critical, is key. In what sense? Well, mostly civil society and communities, we have different umbrellas, and it is clear that we should have some prioritization and the function on the demands well defined. And also, finally, the diversification and financial sustainability is not only from the global fund or the government. It is important to diversify the sources, and that can be started from our house and our places. So in that sense, we are found in this fight with limited resources. We need to keep on integrating ourselves. And then the last one is the last mile. We need to run this last mile in the countries of Latin America. It is not A or B. We need to be complemented. This is a dialogue that we should have with the government based on evidence, prioritization, and diversification. So this is the call that we are inviting you to take advantage of this cycle 8, and let's see what we have learned in those countries that come from this second window. Thank you. Thank you so much, Maite, for this complete, for this presentation so complete, that gives us back the task to each one of the countries to start on analyzing and seeing us again, and identify what do we miss, and what how are we standing towards these challenges. So we have 3 minutes or less. If you have some questions for Maite, just questions to clarify the issues, and later on we will have some space also for comments and discussions as based on the experiences from these two countries. But if there's any question. So the truth is that this presentation is very clear, so maybe that's why there are no questions as of now. So for those who would like to add your questions within the next two presentation, maybe you might have some questions. There's one question from Angel from Colombia. This panorama also led us to set in the countries where is it that we are going to evolve on the figures of the MCPs and the with this strengthening towards the transition of the global fund. Yes, exactly. That's part of the discussion. This is something that we should consider within our countries. So while you are going, while you have your questions, then now I will give the floor to our friend Joan Tejada. He's an expert on this transition and sustainability efforts. He's a counselor from the Global Fund, and he's here today so we can hear from his experience as for the use on the guidelines on the preparedness of the Cycle 8 grants. Joan, the floor is yours. Thank you, ladies. Can you hear me? Yes, we can hear you perfect. Thank you so much for your invitation, and thank you everyone and everybody for being here today. So my presentation will be shorter, basically because there are things that they had given, Maite has shown us clearly, and there's no need for me to repeat. I just want to summarize or to resume the experience, the working experience that we have had in general in Latin America, but mainly with Paraguay and Guatemala, which are the countries that I'm just accompanying the process for a longer period with Paraguay and recently with Guatemala. So, as of this experience, I would like to give you five basic lessons, not so extended, but what I have learned, and I think that I have learned with and thanks to the country, and I think that this will be useful for the total region as such. So the first lesson is that that same measurement doesn't it's not useful for everyone. So that idea has been mentioned there by Maite, and I would like to highlight it. The same measurement is not useful for everyone. And of course, there are some guidelines from the Global Fund that are thought to give these guidelines, but they have to be adapted to each reality. Sometimes what the guidelines say, we need to reflect on those, and we need to see if it's applicable or not to our country, and if they are, how, because sometimes we get anxious by reading things, and we just keep paralyzed on that idea because we don't understand exactly what is that related with us. So you need to consider things like as they are just a guidance, they are not a strict mandates. And the second one is that this guidance is effective when we are able to distinguish whatever we're going for, when we know exactly what we want, because this guidance doesn't make miracles. I mean, this is a tool for us to help people to clarify their ideas, and also being able to define a priority order within those ideas. So, but it doesn't tell you what are your priorities. Your priorities need to come from the evidence, from the data, from the country itself, for what we know about the country. And one thing that I have learned is that we need to do this pedagogical learning on why we speak about sustainability, or what is it whenever we speak about those sustainabilities, what is that about. One is the national response as a whole, that we all are involved and that we are worried about, that how is it that how is it that we will keep on financing the services, mainly those services for prevention of for key population and others, as well as for people living with HIV, as well as for people with TB and with the malaria groups also. So that's the total of the national response. But then what goes within or what doesn't, as part of the integral responses of that response. So that on that one, it is a technical and a political discussion, so that's important to consider. Another thing is that it is related because the three of them are related, but they are not exactly the same. So what is the sustainability for the community services? And we understand that community services are those that are adapted to the needs of each population, and that the perspective that the community is being included. Not always these services are the ones that are implemented by the NGOs through the social contracting. There are different modalities to be implemented within the community services. In malaria, for example, they use the call goal. In the TB, we have the organizations for those people affected by the TB that mostly they work as volunteers. There are some other countries that hire people from the key populations as part of the public services, and those they are also community services besides those given by the civil society organizations. And sustaining them, for that they need their own diagnosis and their own strategy. And finally, and not less important, also we have the sustainability of those organizations that provide the community services. So this is something that it's important to distinguish, because each one of these three elements, even though they are related among themselves, they don't necessarily mean the same. And sometimes it is complex to distinguish this discussion. What does that mean? What does the sustainability mean facing the national response or the community services that do not need always the same type of solution? So that's something that we have learned. The second lesson is that even though the objectives are shared, the way to reach them is complete. It could be different, and that doesn't. And this is a variant from the first lesson also. And in that sense, Maite also had explained that. Maite has been speaking about this topic, and there's more than one model of sustainability for the community services, and they are not excluded among themselves. We have social contracting, we have the public community collaboration agreements, and then in this case we can open a full box of what is it that we're speaking about. There are plenty of models that the public sector provides inputs to an organization, that they cannot sell them, but they can use them to offer the services. That these social contracting are included within the networks, for example, that work on the land piece, and also to have a role as service providers. And that's a very broad field. We also have the public contracting of community workers and many more that we can imagine. So it is important that one model doesn't exclude the other. There are some countries that they share these models and they complement each other. So the important thing here is to find out which is the role that each one of them had, and how is it that they are sustained and financed. And the third lesson, and in this case, I would like to make a special remark. In my job, supporting so many countries from Latin America as well as from other regions in the world, one of the most frequent sentences or words that I hear is that this is not possible. This here is not possible. We have tried to implement it, and there's no way to do it. So there's no mechanism to do it. There's no political will to do it, and there's not even. And based on my experience, the reality is that that perception might be based in some fundaments, was because the authorities felt close to these ideas while the Global Fund was there, and the Global Fund has other donors as PEPFAR. So at the moment that the Global Fund says, I'm leaving, and the government from the United States says, I'm leaving before, sometimes and most frequently, there's this openness. There's this openness, and where it seems that the things were impossible, then discussion opens. So I'm not saying that this is something easy. No, no way. I mean, it requires a lot of work, a lot of effort, and we need to speak with so many people, and not only from those responsible of the national plans, but also with the other ministries that are involved. Who are the ones who deal with services? Are there some backgrounds with other areas, and how is it that they have been done, and who made those decisions? So at the end, all the systems, they have these spaces and they have these doors if they want to meet. This is a matter of political will, but also on our capacity to being able to find within those health systems, to find those champions that can help us understand what are those spaces or those gaps and where we can cross them. Two examples here in Paraguay. I think Sergio can expand more about this. He has a lot of great experience and knowledge, but in Paraguay, we just received for many years the message that it was not possible, that it was impossible for this country, for a very conservative country and with a very closed politics. There was no idea on having the organizations. However, that discussion is open now. There's a lot of uncertainty, and there are so many things that need to be clarified. But the discussion is open now. They don't say no anymore. Now they say, let's see, maybe. It seems that this mechanism may work. So we need to explore the idea. So in that sense, we are seeing how is it that we can do it through these local health boards. And as Maite is saying, using these pilot programs and mechanisms to test those implementation means to create this background and this, and so then the country can see that the added value to the organizations is key for the sustainability of a national response, and in this case for HIV, but also for TB and malaria. In Guatemala, also, there was a lot of pessimism as for this possibility. But now, after expanding the discussion space, and mainly with the Vice Ministry of Care Services, they were able to find some people that are on the development of these health services networks, and they are open to receive how we can include those community services within these networks. So without any success yet, we don't know where we are going, and we cannot say that this is the path for this social contracting, but they have this openness. There's this openness because they give the value, and we offer this value with clarity on the work of the civil society organizations. And the countries know, even though they haven't spoken out loud, they know that they cannot move forward within their national and international commitments without the civil society organizations or without the community services. The fourth lesson is that with the proper support, organizations know how to find their own way to sustainability. And in this sense, I know that Sergio later can give you more examples, mainly with the work that they do in Somos Gay, and a very beautiful work of a clinic, of a community clinic, the Opumi clinic. So they've been working on how to give this sustainability to the organizations that provide the service and that they have received support from the Global Fund. There's a lot of discussion. Not always they have disagreements, and there's a lot of coming and forward on the proposals and contra proposals, and a lot of clarification. It is complex. It is not easy. Sometimes they feel this weight of this bureaucracy, and sometimes they don't understand why. But the path is open, the path is there, and the organizations such as Somos Gay that I've already mentioned, or Opumi, that work basically with the women living with HIV, that they had designed their own cloth label, and they receive the benefits. The benefits go to this organization for women living with HIV. And also we have this Fundación Vencer. They've been working with several individual and corporate allocations, and they have companies in Paraguay that provide these non-lucrative benefits. So they have a very clear plan to implement it. Or units who work with sex workers, and that had allowed them to take advantage of the international connection that they have through this Red Trasex, and also to have some other cooperation projects with other multilateral organizations where they discuss topics for women, gender, training, empowerment, and citizen participation. So I think that these are experiences that yet need to grow, but they show that with the proper support, the civil society organizations can find their way towards independence. And the fifth lesson is countries are not repeated, but they rhythm. They go to they have their own rhythm. It is true. It is not the same. The same doesn't work for everyone. But what one country has done may inspire the others. And in this sense, we are in the process to start the path with Guatemala. It's been part of the work during cycle 7 that wanted to be combined with within this year on this internal strengthening, on managing the capacities, and we're dealing that with new activities. And one of the things that also might mention, but I would like to reinforce here, is that we need to show this added value from the organizations. We need to collect the data, we need to analyze them, and also we need to publish them, and we need to use them with and being proud of them. But if it's not done, it is very difficult that some decision makers, mainly those who are away from this contact, from this direct contact, it is important for them to understand why it has to be financing, because for them it might be difficult for them to understand. So that's why we need to show that added value. Also, we need to have these diversification strategies to reduce that. Each organization should know exactly what is the model that they follow, or we need to know their roadmap, and reduce this dependency not only from the global fund but also from one unique donor. Not it is not even good if one country, if the government is open to finance you, it is not good to depend in excess, because governments change and they can change their policies. So that's why diversification is very important. We should never depend only from one financing group, and also to have a more efficient management of the resources. It is not only to have different resources, but to use them in a more intelligent way to increase resiliency, that in case they increase or decrease, we always have a base that will allow us to travel these disturbances. So these were the messages that I just wanted to share. This is just a summary of what we wanted to bring to the table, to understand the local context, knowing that this is not static. We should not focus on what it is, but on what could become. It is not that things are like this, okay, but then they could also be different. We need to find how to get there. Public services, they also may show certain rigidity, but all of them have doors to be open, and such as Peru, that I worked last year, they are demonstrating that. So also we need to consider that the decision makers, they need to understand that the added value of the community. You need to collect, to analyze, to show the evidence of the impact of their work. Also, you need to request support, but also you need to demonstrate that you have moved forward. Sometimes we ask again for the same thing, and that what we have asked in previous cycles, and it is difficult to understand if it has been financed, why is it that it is not working. So we need to build based on what we have achieved. We should grow based on that foundations. We need to say, well, you supported me, and with that support I've been able to reach this level, but now I need to go forward. Now I need to continue. And in that sense, we need to be innovative. We need to think what are the next step based on that foundations that we have defined. Try not to ask from the same, but also to understand where is it that you have reached and where can you go forward. Transition is a challenge, of course, yes, because it goes beyond what we're used to, but it is also an opportunity. It is also an opportunity to grow and to become more independent. Sometimes I see things that touch my heart when I see that there are some organizations that, even though they are facing many difficulties and even with a reduction of the funds, they say, well, yes, I might not have the fund, I might not have pet farm, I might have less money, or maybe I won't have any more, but I move forward and now I'm more free. So I don't feel that I'm working all the day for the donor. Now I'm working for my own project, for my own project. So if the donor, where if the donor wants, there's a space for them. But we are here, all of us who define that space, and that is really beautiful, because the community has been able to find this path of this possibility of resiliency as well as a future. Thank you. Thank you so much, Joanne, for this great presentation, and thank you for sharing with us these initial experiences with these two countries. And just like Julia and Maite, open this mind and think on different paths, maybe not at a central level, but yes, at a municipal level. And in that sense, we can keep on working different ways of sustainability as well as of other ways to keep on with the response and the activities that we've been doing. So now I will give the floor to the experiences that we want to share today from Guatemala and Paraguay. So first, I would like to give the floor to Guatemala, and then we will move on with Paraguay. Leonardo, are you ready? Yes. So hello everyone, it's an honor to be here with you. I will explain a little bit what is it that we have seen from Guatemala and the civil society, specifically this path towards sustainability and transition. We're just elaborating the proposal and also telling you that we are getting ready for the second window of cycle 8, and that this is a process that has opened us to many discussion on sustainability and transition. So the important thing to mention here is that from the civil society, we have been able to see that the topics that were never discussed, this process had allowed us to include those discussions. And we ask several questions. How can we sustain those things that we have achieved? How can we sustain those community responses? And from there, we did a very important exercise. We saw what are the elements that we have. And in Guatemala, it's important also for the other countries to consider. We were able to identify those tools that are important. As for the HIV response, we have a law, that's the Decree 27/2000, and also we have a commission, a national commission. This is a national multi-sectoral commission from different organizations that looks toward STIs, HIV, and AIDS. So there's a lot of challenges, of course. There are many things that we need to work, but it is important to identify what are the things that we have, these legal fundaments and these articulations, that in that case, we were able to identify those opportunities. We also now we have these spaces where we will be able to have this dialogue with the MCP, and this is a great challenge, being able to unify all the voices and all the sectors, but we've been running that process. So let's remember that the transition is not only the responsibility from the government and the civil society, this is a shared participation. all the sectors need to be involved, and in Guatemala we are in that process. So what is it that we have learned from this experience? Well, transition should not start early. We heard about those grants and in previous cycles, so we need to be prepared, and we tried to do some beginning. We tried, but once that when we were at the door, we started to find for those solutions. So that's what we have learned. Transition should have started before, but now we are in that process. Something that it's important to highlight is that when we speak about sustainability, we only think about money. So we think who will provide the money for these activities. But within these exercises, we found out that there are some more questions that we should ask, not only about the money, that who will be financing, who will implement, who will coordinate, who will monitor, and who will represent that communities, and who will keep those abilities. Sometimes these discussions are given in a national responses, but the outcomes are in the communities. In my case, I represented a community and organization that are within the country, and we have always mentioned about this decentralization of the activities, because it happens that at a national level projects are temporary, and then at the end the territories are the ones who face the needs and the responses. So therefore we were able to identify it as MCPs, and we have done several exercises that to identify within the interior what are the organizations that are there, what are the skills that they have, what are the services that they offer, and how well articulated they are with their health system. Civil society not only should be consulted to validate documents, but also should be part of that whole process to be able to develop that proposal, as well as these transition sustainability plans as a whole. Next slide. So we identified several challenges and opportunities. This transition, we look at it as a risk, because we've been in several cycles with the Global Fund, but now we also see it as an opportunity to strengthen these aspects that maybe before we weren't able to analyze in depth. So here in the screen you can see, and this is just a summary. We have two challenges and two opportunities that it is important to share with you. One of the challenges is how can we keep the services for key populations? And what I want to say here is that how can we ensure that those services for key populations still are a priority in the future? As I was reading some of the comments, sometimes they refer to the political will on how well sensitized are the politicians. So in that sense, we need to identify those organizations from the community that had created many relationships with their communities, and that they have developed specific skills to reach them. That's the challenge that we have. Also, we have the challenge to strengthen these local capacities within the territories, because as I was telling in the previous screen, if we identified that these organizations that are working in the territories now, with this, the challenge is what are the skills that they have within these organizations? What are the organizations that are responding? What are the ones that are being financed? How is it that they are being sustained, or if they are still depending on the international cooperation? What are the services that work properly, and where are those gaps? That's a big challenge that we are facing as Guatemala. We are also looking the need to strengthen these local alliances, so it doesn't depend on local actors, but also at the end then it is part of each one of us. So in that sense, that leads us to identify those opportunities. And something that happened to us here in Guatemala, and we were able to identify the civil society and MCPs, is it is important to know what is our ecosystem on response. It is important to guide these co-responsibilities that we have in each one of the sectors. Something that also happened to us, and that it's also an opportunity, is that this transition process and sustainability is making us to see who are part of this national response. Not only the government has to be part of it, but also this has to be a responsibility from all of us, community organizations, networks of people living with HIV, international cooperation, the academia, service providers, and so on. So what we're trying to do here, and we're always within this process, this is not like the best prescription that of what should be done. We are within this process, and we are being able to identify, and we are knowing what is our response, so we can understand our strengths, because where we find these gaps is where we can complement better by identifying them. Also, as an opportunity, we need to strengthen those alliances so we can have a sustainable response. It is always important to consider that in order to have a sustainability, we need to find those alliances with other sectors. It's been difficult for us, but we're always looking for those doors. So where else can we have these accesses to different projects? And something that has supported us, and the Global Fund has mentioned, is this social contracting through the ministries. In Guatemala, we've been doing this exercise, so hopefully this transition moment is there so civil society can have access. In Guatemala, there's just a few that have been able to get the financing from the government through the social contracting of services. So we want to expand this portfolio. So through this transition, we can have access to these funds that come from public instances. So it is also important to mention that in Guatemala, spaces such as the MCP have allowed to gather several perspectives, not only to discuss these current needs, but also to be prepared for the future. And in this last graph, I can tell you that in this last slide, I can tell you that based on our experience, what can we give to other countries that will be within this process or that are in parallel to us? So one is that we need to know this response, this ecosystem of response. We need to find out where is it we are, where do we need to go. In Guatemala, it happens, for example, that when you go to an office and you ask for a meeting, they say it is not here, it's in the next one, and in the next one, and in the other. And they're just moving us from one office to the other. So it's important to know what is the ecosystem of response that you have, so we can guide our actions. We also need to strengthen our alliances as of now. If we are in a previous cycle of the transition one, we need to identify those alliances so we can strengthen them, and not to wait until we are there in the transition. It is better to do it to start before. And also, sustainability is being created day by day. We don't need to think or when is it that we will get close, but we need to involve the civil society and the territories. And something else that it's important and we have promoted is that those skills need to be strengthened. The capacities of other institutions, not only the ones who receive the grants, but this knowledge has to be spread out so we can have a national response at a national level from the territories. So this is my presentation from Guatemala. We are not sharing our experience. This is not a successful, this is not a final result. We are still learning from this proposal, but it's something has teach us is that this is not being created when the resources are reduced, but it is being built when countries start preparing, when they strengthen their alliances, when they hear their communities, and they start thinking on the future of the response. Thank you so much. Thank you so much, Leonardo, for these lessons that you had shared with us. And sorry for being so fast. I was not able to introduce you properly. This is Leonardo Ortega. He's from Guatemala. He's the director of the GACSON organization in Quetzaltenango at the north of the city of Guatemala. And right now is vice president of the country coordinator mechanism in there. Thank you so much, Leo. It's been a very complete experience that you had shared, that you've started in Guatemala. And I think that the lesson here that I highlight is that we need to start, all of us, even us in Peru that we started cycle 7. It's important to start thinking on transition and sustainability. Thank you. So now we will keep the questions at the end, and now we will give the floor to Sergio. Let me introduce him. Sergio Lopez is from the Somos Gay organization in Paraguay, and now he's also part of the Petit Comité from the writing on the grant in that country. So he will share the experience of Paraguay in the design of the Cycle 8 grant. Thank you. Thank you so much. Can you hear me? Yes, we can hear you perfectly. Okay, then, so thank you. Happy, proud month. So it is very interesting to see all these topics. I like this order of the speakers. So whatever I had and highlighted to mention, it's been already said. It is well said. So I just want to tell you that the experience that we had at a local level, I'm not here to give you like a prescription or something to do, but this is the local experience that we have had. As a context, also, I can tell you that in the past 2 years, we faced a complicated situation, 2024, 2025, as for the materials, not only for the cut on the financing for HIV and AIDS, but also in these political aspects that we have this scenario in Paraguay. By the end of 2024, we closed that year with a strong law that was implemented here in the country, and this is known as a anti-NGO law, and that makes difficult as for the external financing that we receive as organizations for the work that we develop. So that context is also given within a very conservative and strong, as Joan mentioned, it is a very conservative country that leads this ranking, but it is real, and based on we have a lack of different laws that protect us from discrimination and stigma. There's only one law that protects people within the framework of HIV, but this is a very difficult environment to work as a civil society organizations offering services for AIDS. So within this context also become more difficult within the context that we have within the cut of the budgets that we have. So based on this context and on the experiences that we have had, this transition scenario, we've been facing that for several, or we've been discussing that. Let's say that this is this pink elephant that is there in the room and no one says nothing about it. So we didn't have like a fixed term on when will that happen. So on one hand, I rescued the urgency matter for the country in order to evidence how is it that we're going to sustain these services, and basically how is it that we're going to sustain those with the fund, but in the ideal what we share in Aliados in Salud, we know that we need to scale that and to expand that of what we have done as of now. So for us here in Paraguay, GC8 matches also with this uncertainty period. As for the mechanism that will be defined, it was also mentioned in previous presentations the possibility of implementing a more territory response, or a response that is being managed by the territories and the municipalities. And I take also the idea of Leonardo that the idea of making it in a more territorial way for the communities that we are at a local level. So this exercise in the ideal in Paraguay will be really great, so we can decentralize. Also, I say that there's a lot of uncertainty because the mechanism, it is not finished, it is not defined, and it is also what Joan also mentioned. In Paraguay, we have this local health board as well as the department boards that they have a budget allocated to fulfill this health plan. The intention is to have a resolution or a law from the minister to shield or to reinforce this year, or maybe in a pilot, we will have a financing from the global fund to execute it with public entities, and to have this board that will be created. And I it will be like having an PR installing an office in a public office from the state, where they can manage these budgets once the global fund is over. So we can have this practical exercise to put into practice those things that can be adjusted within this opportunity that we have for these 2 years from the next cycle. And I mentioned a couple of years because in 2027 we will have the grant, and potentially for 2029. But here in Paraguay, we also have this situation that this year we are we will have 3 years for election period in different areas. This year we have the internal ones. Next year we will have the internals, but also for these intendants and new municipal authorities. In that sense, that creates this uncertainty because there are certain doubts on how this money will be adopted. No, once these plans, once that they are approved, and once that these authorities change, we know that most of the plans from the government will have some interest, and we might say that AIDS is not one of them. So we need to develop a lot of lobbying, we need to have a lot of discussions, and also we need to develop these alliances where we recognize the great value that they have to contribute. So in order to achieve this, in order to have the benefit not only for the community but also for the organizations, that's I would like to make a difference. No, and thank you, Joan, for also mentioning that there are several sustainabilities that we need to enable and that we need to go forward. But in the interest of the health public portfolio, we have the opportunity that we measure through health indicators. So these mechanisms from different grants that we'll be implementing and we will start piloting this year is related with a grant based on health outcomes, and these are measures measured with indicators. There is not the opportunity to give a discourse far away from data. So we have this opportunity for those who offer these services for AIDS. We can assure in a way whatever we have achieved as for now, and to have these differentiated plans that can be sustained for our services, and also within our understanding that also will improve quality of life and the mission that we have as an institution. I think that Maite was also mentioning that we will have that the organizations will need to reduce our actions, and in that sense we are and due to the opportunity that we have with the global fund, we will start defining new entities and also having the opportunity of these social businesses. And also, Joan, thank you for mentioning the developments that we are having here in Paraguay. In our case, as Somos Gay, we have a health program from the clinic that work as such. So this was a program, and it started growing, as long as the work started being complex. So as of now, as a social business in Paraguay, the idea is that we can strengthen the clinic. So it represents a mechanism with a business plan that can reinvest the surplus, because the idea is not to become rich with the clinic, but the idea is to stop financing, to stop depending from a financing. So on one hand, I'm happy and sad, no, because the idea is to cut certain bonds with the dynamic that we had followed. And with this, we also rescue. And just to close my presentation, we the vision to the future that we're having is to have this alliances scenario, because the state alone cannot consolidate. Even though here in Paraguay the health ministry is a monster, it's a big institution, it has a great presence at a territory level, and there are many things to improve always. That will be always, but the infrastructure or the architecture is there. The legal institution is there already, so we just need to find the gaps and the best opportunities, so the civil society organizations are not left aside. For those who were supporting, Paraguay is the second country in Latin America with the expand of PrEP, and that's a result. That's an excellent result, and we are so proud of that. But let's recognize that that wouldn't be able to achieve it only with the state. And there's also the recognition from the state that they need the community work, because there are certain situations, or because of the schedule and the working or schedules, that none of them would like to work. So whatever they need to do with AIDS, they consider is something separate from their work. So recognizing our reality, that hopefully it changes, but in the meantime we need to have these responses. So that's what we want to promote, and in the future we are also for the colleagues of the Global Fund. So if they can support us on channeling this opinion and these ideas from our community, that yes, we need to think on a future mechanism for a catalytic grant, or a more direct one, so we don't have these sub grants, but also to consider one way to to have this great opportunity in a 2 or 3 years. But for the more good activity or good vibes that we put there, maybe so many things will not finish in 3 years. So let's not stay there for what we had already. So we can keep on working on that. And that would be my presentation. Thank you so much. Thank you, Sergio, for sharing with us this experience, and also this adequacy to the Paraguayan context. Maybe we have always think on keeping our organizations as they have been working, but this depending on the legal status or the bylaws, is a way on adapting to this challenging context in the future, that goes on strengthening our system of that type of information, and to have clear costs on how much does it cost to offer a service in particular, in such a way that we can show that, as Julia and Maite were saying at the beginning, how efficient we are from the community organizations, the benefit cost, what does that mean, investing on community organizations, and in that sense being able to achieve the end to the epidemics. So we'll still have a little bit of time for questions and answers. While you think on your comments and questions, you can, in the chat, we just included 2 links to different tools that will be really useful. On one hand, we have the community tool that has been developed by the Anglophone platform from Africa. And on the other side, we also have the link to the community guideline on the integration of the cycle 8 of the global fund from an EANASO. So both guidelines are really useful within this design of the grants process. I don't know if there are some questions. No one is raising their hand, and there are no additional comments in the chat, just the one that Pablo has been speaking with the speakers. So in this case, well, telling you that this webinar will be embedded in the channels of the platform, that the summary and the slides presentation would be included in the next newsletter, as well as the guidelines that we are sharing. And also we will let you know, as for the translation, we will see the way to have a translation of this recording and making it available in the networks of the platform. Joan, yes, well, waiting for someone to raise their hand. And I just wanted to add something that it is related more with the strategic. I know that this is a very complex topic, not easy to resolve, but one of the things that helps a lot to work on the sustainability issue is that the community or the community groups need to learn the differentiation of these two main roles, when they want to work as a service provider and when they want to have this role on people who protect the interests of the populations. Both things are not totally independent because services are the rights, and rights should provide services. But it is true that keeping two different types of dialogue allow maybe to move forward on the technical aspect, which is also political, and also other people should, or through other organizations, should focus on the political, which is also technical, but because it has to be based on the evidence. So this is something that has helped a lot in those countries that they had put it into practice, because then we can move forward in some areas. And maybe, and I just want to take advantage of this, I would like to put into the table that don't let a disagreement block the whole situation. Try to reach an agreement on those disagreements with the government or with other actors. So park it, set it aside for the time being, don't forget about it, and then focus on what you agree and how will you develop, or how will you implement, monitor, and evaluate. And once that you have that secured, then you go back to that disagreement, because you don't get rid of that. You don't quit to that disagreement. Those represent your principles and how you see things. But separating those roles and let not the disagreement block the agreements are things that allow you to move forward step by step. Thank you so much, Joanne. Thank you for that reflection. And I think that you were able to invite the others to open their microphones. Alberto is here. Beautiful people, and so dear to me. Hugs and kisses for everyone. And I'm just fascinated with this session, and I've learned a lot. And also I've remembered so many others, but it calls my attention, and I don't even know how to say this, but I would like to include it in the session, in this discussion. So it seems to me that there's a conflict of interest or of different objectives. The fact that one member of the civil society is working at the same time within the government, because we have different perspectives with different the government will always be the government, and civil society will be in the next side of the road. So it is important dialogue, it is important negotiation, articulation, it's important also. And in this case it is being reaffirmed in all those who had spoken in this session. However, that makes noise to me. So maybe I'm just setting aside, or I'm just backward, and or maybe I have a more conservative perspective. But those of you who have more experience, I would like to receive your guidance. I don't know if some of you will have the same concern that I have. Thank you so much. Thank you, Alberto, for your question and this reflection also, that it is true, it goes together with the organization and with those actors from civil society. And you've mentioned about this, we've been mentioned about this social contracting from the ministry or from the governments. So I don't know if someone would like to answer. Maite, Joan. So yes, I have my opinion, but I don't want to monopolize the microphone. If someone wants to answer before. So I just want to say that no one knows more than Alberto Nieves. first and foremost. And I think that these are two different things. Being part of, I mean, it is true that sometimes we use it as a synonym. You are part of the community if you defend the community to be part of a key population or by being with HIV. And yes, there are people that live with HIV that work in the government. It has happened in several places and it's still happening. And there's a discussion, there's a dilemma there, because they said that that's a good idea because it provides the vision to the government, and they say once that they are there, there's the devil, and then they forget where they come from and they set aside everything. Yes and no, because when they work within the government, they should follow certain rules, and I do believe in those internal lawyers, no, in the internal advocacy within the governments. It's important to be inside and also to use all the spaces and all the possibilities that they can have there so that the internal culture can change. And I think that there are people there that try to do it. Not always they achieve it, but it's important. And that's different from the status. If you are within the government, you are not civil society anymore. That's clear. You are civil society because you are a non-governmental organization or because you are a community-based organizations. Either you are or not a key population or vulnerable population. So clearly you are the government, you're part of the government. And another way it is to provide this sensitivity and awareness within the government institution. But if you don't belong to any of the key populations, or if you don't live with HIV, TB, or malaria, works in civil society, that's civil society. Even if it's a cisgender woman that doesn't belong to the LGBT community, it's civil society because it is there and it is within that part at that moment. So it is also truth. And Alberto, I understand that each country is different, and I know that Venezuela is a case that we are all have in our hearts, but I always say that peace is done with the enemy, no, just to say it, or negotiation is done with the different, with the one that doesn't think like that, because if they think like you, there's no disagreement. But it is true that each one of them have their own role. We need to put an effort to understand. Sometimes we don't like public officers because we think that they are bad persons, but so let's try to understand their position. And we're not going to ask for something that they cannot give, because that will be a useless discussion. Let's try to understand what they can give us within this negotiation process and what can we give in exchange. And this is something very useful within this process. So I don't know if Alberto would like, if I answer to your concern. So thank you so much. You had just expanded the reflection that we have here, that it's in the hands of the countries. We have a final comment here before closing the session from the MCP Guatemala. I don't know if it's Dori. Yes, it is Dori. I have a very interesting experience about this topic. When I was director from the HIV program from the health ministry from the year 2000 to the year 2004, we were able to hire two MSM and two sex workers as part of the program. However, the next government fired them. After that, there was also one person that was also a MSM, and it was at a personal level, and that experience was completely different when it comes from an organization that when it comes from an individual. It's that the person is part of the government and doesn't defend the interest of the community, at least not openly. Thank you so much, Doris, for sharing the experience from Guatemala. So now let's close. If anyone would like to give a final comment, Maite, Julia, Leo. If not, Anar, can you give us the final comments on the closing? Thank you. Well, there's no much to add. I think that it has been a very complete webinar and very good reflections and education. I just want to thank Julia, Maite, Joan, Leonardo, and Sergio for letting this webinar. And just well to reiterate that from the LAC platform, we've been working supporting some countries within these dialogue processes for the preparation of the grants in the Cycle 8, Paraguay, Guate, Cuba, and we will keep on working by the end of this year, developing these materials that would allow the participation of the community within this process. So until December, we will be supporting, and I just want to thank you that, well, this webinar is part of these efforts that we're doing. And then the next webinar will be about integration, so be aware of that so we can speak about this topic, that it's also included in the discussions of those countries that are within their analysis and preparation processes for the grant aid. Thank you so much, and see you in the next one. Thank you, everyone. Everybody, thank you for your participation. Have a nice day.